Good morning. This is Dr. Stewart at Timonium Foot and Ankle Center. We are looking at this nice toenail here. And this young lady came to me about 6 months ago, and she had a badly infected ingrown toenail. And she's now coming back about 6 months later, and this ingrown toenail is now infected and bothering her again. Now, when she came in 6 months ago, she had a bad infection, and my typical protocol is to treat the infection first and then about a week or so later do the ingrown toenail. And the reason we like to do that is because when you put an acid inside of an infection, the pH from the infection in the tissue is a little higher and the pH of an acid is a little lower. And what can happen when there's an infection, the acid can get neutralized, and the acid's job is to kill the nail. So if you look at my fingernail, you see that white moon-shaped area. That sits in the base here, and that's what we're trying to kill with the acid. When you put the acid in here, and there's an infection, the acid doesn't work as well. Well, let's fast forward 6 months. We're now back with the patient, and the patient has a recurrent ingrown toenail with an infection. So she's going to need to have a revision. And the revision will be done after we get the infection taken care of. Now, there are certain circumstances where we will do an ingrown toenail in the setting of an infection, and we did this because her infection was so bad that we didn't really have a choice. However, at the time of that procedure, her parents were advised that there's a reasonably higher risk of a recurrent nail, ingrown nail, and that's kind of what we're facing. This infection is very mild. We're going to settle it down. When patients come in with infections, their obvious concern is I need to get rid of my pain. And oftentimes the antibiotic significantly reduces the pain because the infection creates a lot of inflammation in the tissue. So in my practice, 99% of the time, unless the ingrown toenail is so bad, we treat the infection for a week with antibiotics, clear the infection, and then we take out the ingrown toenail, and the chance of recurrence is much lower. With that all being said, there's still always a chance of recurrence with these nails, but I just wanted to show a picture of this nail to show what can happen when you do an ingrown toenail in the setting of an infection and then fast forward 6 months. We are now at that 6-month time, and we'll take care of her and she'll ultimately be fine, but just want to give a little educational video on this situation. This is Dr. Stewart at Timonium Foot and Ankle Center. Thank you for sharing your toe with us.